Hi there. I hope you are enduring the quarantine. Well, you could actually be enjoying the quarantine. So today we are going to proceed with our discussion on social protection, and we'll be looking at the different interventions of social protection. When we talk about social protection, just as we discussed yesterday, what are the different interventions, or what is there when you talk about social protection? So according to the National Social Protection Policy 2015, social protection is divided into two categories. We have the social care and support services, and then we also have social security. So social security, which is really what is the focus of our discussion today, deals with those interventions that are put in place to ensure that people have a degree of income security when they are faced with contingencies such as old age, such as invalidity, incapacity, or unemployment. So, but that as well is divided into two categories. So we have social assistance, and then we also have social insurance. The difference between these two is really in the mode of the schemes. So under the social assistance schemes, here these are usually tax funded, or they are interventions that are undertaken by non-government organizations. And then when we look at the social insurance schemes, these are schemes that actually whereby beneficiaries contribute some amount of money to the scheme, so that in case of the different contingencies that we've talked about, then they are able to draw that money to support them, to be able to cushion them against vulnerability. The issue here is really about ensuring that people are cushioned during those times when they are unable to work. So when we look at social assistance, for our case, for instance, we can have examples such as the Senior Citizens Grant. The Senior Citizens Grant is tax funded, but also donor funded. So you have the government of Uganda and the different development partners, that is Irish Aid and DFID, bringing together money, and then this money is given out to eligible beneficiaries every month. So for older persons aged 65 and above, and now after the eligibility age was revised, it is 80 years and above, given an amount worth 25,000 Uganda shillings every month to support them to access basic things such as soap, sugar, and really basics to run their lives through a month. And then when we talk about the social insurance on the other side, we're looking at interventions such as the National Social Security Fund. We're looking at interventions such as the Public Service Pension Scheme. We are looking at the Parliamentary Pension Scheme. We are looking at interventions such as Mazima Pension Scheme, which targets the workers in the informal sector. So all these really are intended to ensure that people, in cases where they cannot support themselves, in cases where they can no longer offer their labor for pay, then these schemes are there to support them to go through these processes. And but then here the question is, how many of our population, or how many of our people are actually covered under some kind of social security? The current debate right now is, why doesn't NSSF, for instance, give people back some of their part of their savings? Yeah. But then the bigger, I think, in that as well, I mean, which is really a very pertinent question, or a pertinent demand, because when you from the definition of social security, I mean, these are interventions that actually are supposed to mitigate people during circumstances as this. For instance, right now, people are not earning, yeah? But then the other question would be, the people that actually save with NSSF are those who are in secure employment most of the time. Those are the people that are in secure employment, which means that during this month, such organizations can still afford to pay their employees their salaries. We don't know for how long that can go. So for us, I think to rise up now and ask for some money from NSSF is really self-defeating, because at the end of the day, we might need this money when this whole COVID crisis when we finish with this COVID crisis. So I think the discussion now should be more than just NSSF, but then to interrogate how efficient and effective is NSSF as a form of social security. How many people are actually covered by NSSF? I mean, when you look at the figures, we really have about 1.7, or let's say 2 million people covered under NSSF. So, and then also you have about a few hundreds covered under the public sector, the public service pension scheme. And then you have a few others covered under the Parliament pension scheme, and different schemes for organizations that are covering their employees. But the fact is, majority of our population actually, which is whereby most of our workforce is concentrated in the informal sector, these people are not covered by any kind of social security. So situations such as these actually bring those concerns to the core, and people start wondering and asking questions. I think those are the questions we should be asking ourselves right now, that under the circumstances, how many of us can actually be able to have some kind of cover, have some kind of social security?